Hello, and welcome back to the training program for researching the costs of INTS treatment in government health facilities. I'm Win Morgan. In this session, we're going to talk about input procedure costs. There are 3 steps to inputting your procedure costs. The first is inputting resource prices into your master prices list database. The second is selecting detailed costing methods for procedures. And the third is completing detailed costing for each procedure. When you go to the master prices list database, this is what it looks like. And as you go down, you will see that there are spaces not only for personnel, but also a list where you can put in drugs and medical surgical supplies and their costs, as well as other supplies and materials and their costs. And there's also a place for other direct cost prices. That would be something that doesn't fit in with any of the other database areas. The price lists are linked to drop-down lists in the detailed costing worksheets. So, for example, if you were to have 5 possible places or inputs to your personnel cadre selections, then after you've put them into your price list, those will show up in the drop-down list of the personnel part of your detailed costing worksheet, and you'll be able to select them from the drop-down list. Similarly, when you're in your detailed costing and you're selecting drugs and medical supplies, you will be able to select from the drop-down list that was generated from the price list database that you see here. We'll start with the personnel prices part of the database. That's what it looks like. The first thing you'll see in the personnel prices database is a little blue cell that you see right here and a yellow box that gives you a tip on how to fill it out. That part is very important because what it's doing is it's helping the tool to calculate properly the number of minutes that are spent in the average person's working month. So depending upon what your standard working month is, where you're working, you'll need to change this or put this in according to what's standard in your place. So for example, we put in this tip, if you have a standard 20-day working month, that's 8 hours per day, that's 60 minutes per hour, then you'll see that would be about 9,600 minutes. That would be your default. If, however, you have 21 days, 8 hours per day, and 60 minutes per hour, that would be 10,080 minutes per month. If you had 22 days, then you would have to put in 10,560. And what this is going to do, it's going to help the tool to calculate the cost per minute of your personnel time. So when they are doing procedures for treatment, then they will be spending, say, 10 minutes or 25 minutes on it. That will allow the tool to calculate accurately what the cost of that resource is. So do make sure to look at that and to fill that in for your particular country. When you then get to the price list inputs for personnel, you want to add all the personnel types that are working on the activities. So you see I have a general practitioner here as an example, a health officer, a lab technologist, nursing officer, and a pharmacist. Don't add individually recognizable labels for personnel. These are category or cadre names, not the name of the person who's actually doing it. Then input the average monthly salary and benefits for that person in this area. It's where it says SKU price economic. In this case, since we're working with government workers exclusively, only enter economic prices for salaried government workers. Do not put anything in the SKU price financial. Next, you'll want to put in all of the drugs and medical supplies that may be used for diagnosing and treating INTS. So you see here, for example, Cipro, metronidazole, exam gloves, cannulas and syringes, and ringer lactate. Now, those are all put in because they are possible medical supplies and drugs which would be used for the treatment and diagnosis of INTS. What we've put in here is just examples. So you are going to need to use the data that you have collected during your data gathering process and put in what are the appropriate drugs and medical supplies that are used in your particular situation. After you've put in the name of the item, you'll want to put in the name of the package or the group that they come in. For example, here with cephalexin 500 milligram capsules, they come in a pack, and the pack costs 390 of the local currency unit, both financial and economic. But the unit used for the quantity needed for the procedure would be 1 capsule. And there are 100 capsules per pack. So you would put here cephalexin 500 milligram capsule, 1 pack, that's the way that it's sold, and this is how much it costs for a pack, financial and economic. But the unit used is 1 capsule, and so there's 100 units per package or per SKU. SKU means stock keeping unit. It's what's used for many of the drugs and medical supply storerooms. That will make it a little easier for you when you are using their lists. So you'll want to put in all of that information. Most of the time, if not all of the time here, the financial and the economic price are going to be the same, unless you have had some of these materials donated, in which case you would only use the economic price. It's very rare that we find that, but we put that in just to make sure that if that does happen in some of these instances, that you'll be able to pick it up in your calculations and in your analysis. Next, you're going to be putting in other supplies and materials that are not drugs or medical related supplies. At this point, we don't have any, but in case you need this, you can put in those other supplies and materials here in this area, and that would be this category. You just fill in the name of the supply, the name of the package or group that is being sold by, and then the price per package, financial and economic, and then the supplier materials units in the package, and the name, of course, of the material or unit name as the resources used. You will also have a price list input for other direct costs, and often this is used for estimating the cost of tests that are done in a laboratory, and also a hospital bed day cost. So here you can see we put in complete blood count. A single test costs, in this case, 40 local currency units, both economic and financial. And in all of these cases, you'll see it's 1 unit here per single test or bed day. This should be fairly easy. Just make sure that if you have tests as part of the procedure, that you put all of them down in this other direct costs. Once you have completed the master price list, then you're going to want to go to step 4, which is the procedure cost estimates. And it says any perspective because whether you're doing it as a cost projection or a retrospective costing, it's going to be the same. You've already put in the procedures in the setup page, so those will have copied and been put in here for all of the different procedures that you're going to be costing. You'll see in the next column that if a costing has been done, a detailed costing, then we'll tell you that yes, there is a detailed costing available for that. If, for example, you have a situation where you are using a detailed worksheet and there is no detailed costing that has been done, then the worksheet here will warn you that no detailed costing is available at this point, and you'll have to go do a detailed costing. So select the input type for each of these procedures as the detailed worksheet method for the costing procedure. You'll then see that there are links to the detailed worksheet methods, and you can click on those and those will take you directly to the detailed costing worksheets for each of those procedures. Let's take a look at what those detailed costing worksheets look like for each procedure. You'll see that you have the costing for personnel time, for drugs and medical supplies, for other supplies, and for other direct costs. And your job will be to select from the drop-down lists each of the resources that are being used to complete the procedure, to fill in what task is being performed by using those resources, and either the number of minutes spent in the case of personnel cadre to get it done, or the number of units spent in the case of drugs and medical supplies, and other direct costs. So you'll do that for each one of the procedures, and that should be coming from the in-depth interviews that you've done with the health personnel who have told you what personnel are being used for each procedure and how much time is spent, what drugs and medical supplies are being used for that procedure, and the purpose of it, and the number of units spent, and any other supplies that are also used, their purpose, and the units spent, and other direct costs, the purpose of them, and the units spent. When you've completed that, then you will have enough input for the complete costing for each procedure in this cost analysis. So there you have it. That's how to put in procedure costs. We've gone through how to put in resource prices into the master prices list database. We've also talked about the importance of selecting detailed costing method for the procedures in that costing worksheet. And we've gone over briefly how to complete a detailed costing for each procedure. Thank you for your continued participation in this program for researching the cost of INTS treatment in government health facilities.